Okay, so on the upcoming slides, we're going to talk uh, in a bit more detail about the liver, the spleen, and the lymph nodes and lymphatics. Okay, but let's just talk generally about the lymphatic system um, of the different parts of the body. So let's look at the image on the right. So when we think of the lymphatic system, we can think of the tonsils, the thymus gland, where T cells, which are a type of white blood cell, mature, right? The lymph nodes that are all over your body, okay? Whether they're in your neck, your armpits, called your axilla, in your groin, um, they're all over. And they are attached to the lymphatic vessels that are constantly returning fluid that then go through the lymph nodes, and finally this fluid ends up back into the, um, the circulation. Okay? We can also consider the liver as a lymphatic organ. It definitely has other functions. It has a whole bunch of metabolic functions, but it has a lymphatic role as well. Okay? The spleen we'll talk about as part of the lymphatic system. There's little patches in your gastrointestinal tract that are considered part of the lymphatic system called um, Peyer's patches. The appendix actually is considered, we don't actually know the entire role of the appendix, but that is considered part of the lymphatic system. And your bone marrow, where um, all your circulating cells are produced. Okay? So let's just look at the role of the lymphatic vessels um, and the lymph nodes. Okay, well, the lymphatic vessels that you can see spread out in this image, coming from the neck, coming up the arms, the legs, well, they're responsible for removing the excess fluid from the tissues. So when all those capillaries are flowing through your body, including your legs and arms, they don't reabsorb all the fluid um, through oncotic pressure. They leave a bit of fluid in the tissue, and that is reabsorbed by the lymphatic system to drain back into your circulatory system. Otherwise, you'd have peripheral edema all over the place. Okay, so there's many liters per day that the lymphatic vessels are able to reabsorb or take from the tissues and return it to the circulation. Okay? If we look at the gastrointestinal tract, so the lymphatic system within the gastrointestinal tract is able to absorb fatty acids directly and put those fatty acids through the lymphatic vessels right into the bloodstream. That's very unlike absorption of carbohydrates and amino acids, which goes to the portal system and then right on into the liver. Okay? The production of immune cells is in the bone marrow. And when we say immune cells, we're thinking of white blood cells. In fact, all the cells that circulate in your blood really are produced in the bone marrow. The white blood cells, the red blood cells, and the platelets. Okay? So we're gonna talk about the liver, the spleen, and then the lymph nodes / lymphatics on upcoming slides. Okay, so let's start with the liver. The liver is really an unbelievable organ. It does so many things. Okay, so let's think of most of the blood um, uh, returning from the gastrointestinal tract is going through, is going into the portal vein, and the portal vein is taking everything from the gastrointestinal tract and it's taking it up to the liver. Okay, and then it's being processed in the liver, and then of course the liver takes the blood and puts it into the inferior vena cava. Okay, so all the filtering of the blood from the gastrointestinal tract has to go through the liver before it can return to the inferior vena cava and then back up to the heart. And that's called the hepatic portal system. Okay? Clotting factors. So there are many clotting factors that we'll talk about a bit later in the module. They're all made in the liver. Okay? So if you're thinking of protein synthesis, think of liver, because that's where the vast majority of proteins are synthesized in your body. Okay? And clotting factors are coagulation proteins. Okay? Storage. Well, the storage of glycogen, which can then break down into glucose. So our body stores glycogen in our liver in case we need extra energy that can then be broken down to glucose. The fat-soluble vitamins can be stored in the liver. So A, D, E, and K are fat-soluble vitamins. Iron can be stored in the liver, and it's actually stored with a protein called ferritin. Okay, so remember, the body likes to have chauffeurs for many things, so it doesn't like to see iron all by itself. So it has a protein called ferritin that can store the iron. And of course, the liver is able to store an assortment of minerals as well. Okay. Protein synthesis, we've spoken about. Many proteins. Okay, we just mentioned a couple in terms of clotting factors, but many proteins are made in the liver. Albumin is made in the liver. What's albumin for? It's our main oncotic pressure maintenance, right? It keeps oncotic pressure within the blood vessels. Albumin is also a carrier protein for many molecules, including drugs, right? So many drugs are protein bound. And when a drug is protein bound to albumin, it's inactive. So the only active part of a drug is the part that's free in the bloodstream. Bile production and excretion of bile to the gallbladder and into the intestines for fat digestion. Okay, so bile is produced in the liver. What else does the liver do? Metabolism. So it can metabolize fats. Okay, so some of those fats return through the lymphatic system, but they're going to get to the liver. So it can metabolize fats. It metabolizes proteins. It can break down proteins, and it can make proteins. When it breaks down proteins to amino acids, it can also, if it wants to, get rid of the amino acids, and during metabolism of amino acids, it produces blood urea nitrogen, and that's how it gets rid of amino acids that it doesn't want anymore. And of course, carbohydrate metabolism, well, that's where we're talking about the conversion to glucose from any carbohydrates that you've ingested, and then the glucose can either go into cells through the action of a hormone called insulin, or it can go and be stored as glycogen in the liver. And then, of course, blood detoxification, right? The liver is able to also detoxify the blood. So it's very important to know that, yes, the kidney can definitely excrete many waste products, but the liver is also able to detoxify many molecules and many drugs that patients take. Okay, so you can imagine if someone has liver failure, there's many drugs that we now have to be careful with, since their liver isn't able to metabolize and detoxify the drug. Okay, so the spleen is also part of the lymphatic system, right? And what does the spleen do? Filtration of blood. So there's a large artery, the splenic artery, that goes to the spleen, and blood is constantly being filtered there, and old defective red blood cells are removed from the circulation. So typically, red blood cells survive about 120 days, right? So about 4 months. What else does the spleen do? Well, the spleen is filled with white blood cells. So it has lymphocytes, monocytes within it, and they can monitor the blood and fight potential infections. That's why when you lose your spleen, say you had a bad injury and you had to have your spleen removed, well, you are at risk for potential bacterial infections because you had a splenectomy. Okay. What about storage? So some red blood cells, white blood cells, and platelets are stored in the spleen, and they can be released into the circulation. Okay, they're not produced there; they're stored there. Okay, asplenia we spoke about. The lack of a spleen puts a patient at high risk for future bacterial infections and sepsis, and that's why after someone's had their spleen removed, we typically give them a number of immunizations to try and avoid them from forming bacteremia or sepsis. Okay? So a patient that presents with a fever and they mention that they don't have a spleen anymore, we're going to look very hard for a potentially invasive bacterial infection. Okay, so lymphatics and lymph nodes. We've spoken about these a bit already, but just bring back to your mind that image of all those lymphatic vessels and the lymph nodes, whether they're in your neck, your armpit, or your groin. Well, this system is responsible for returning fluid back to the bloodstream, okay, because the capillaries weren't able to reabsorb all of the fluid that they released and then reabsorbed by oncotic pressure. So the lymphatic vessels pitch in and take some of that fluid back to the bloodstream. Okay? And not only can they take fluid back, but they can also take some proteins that leaked out. They can take some fat or hormones. They can be returned to the circulation as well. Okay? What about the lymph nodes, where the lymphatic vessels drain to? Well, they're like a filtering of the lymphatic vessels, and they can filter out foreign particles, antigens, and pathogens before the lymphatic vessels put all the fluid back into the circulation. Okay? So now the lymph nodes are also, they tend to be clustered in many areas, right? But we still have lymph nodes in our chest, lymph nodes in our abdomen. But when you look at that image, you'll see that there's quite a bit of clustering of the lymph nodes in the neck, the armpit, the groin, and they contain lymphocytes. So T cells and B cells to help fight infection. Okay? And when there's a cancer, or if there's a malignancy of the lymphatic system or the lymph nodes, we call it a lymphoma. Okay, so let's do this question together. When doing discharge teaching for a patient who has had a splenectomy following an automobile accident, the nurse will teach the patient about the increased risk for, well, it's definitely infection for sure, okay? So lymphedema, so the answer is A for this one. But let's just talk about the other ones. Lymphedema is where you have edema of an arm or a leg after the lymph nodes have been removed, say, from your armpit. So, for example, someone who had breast cancer and they had their lymph nodes dissected away in their armpit, in their axilla, well, they can be left with chronic lymphedema to that arm because the lymphatics aren't able to drain the fluid out of that arm anymore. And that can be a big problem for some people because the arm is heavy, swollen, they can't bend their fingers anymore. Okay, I know that's not part of the question, but just so you know. Okay. The other ones aren't related to a splenectomy at all. So chronic anemia, we'll talk about chronic anemia later. Delayed clotting, we'll talk about clotting a bit later in the module.